Dr. Linu Abraham Jacob. I'm a professor and head of the Department of Medical Oncology at Kidwai Memorial Institute of Oncology in Bangalore. Today I will be discussing with you the liquid biopsy and the role of liquid biopsy in the management of lung cancer. The treatment of lung cancer is becoming more and more personalized. That is, the treatment is not the same for all the patients who are diagnosed with lung cancer. The treatment is individualized, and the treatment is decided based on the underlying genetic mutations or the genomic abnormalities that drive the lung cancer. So in all newly diagnosed patients of lung cancer, especially in the so-called non-small cell lung cancer, we try to find out the underlying somatic mutations or the genomic mutations that drive the cancer. So what do you look for these mutations? Naturally in the tumor tissue. And where does the tumor lie? The tumor lies deep inside the chest. So you get a portion of this tumor by introducing a needle from outside and taking a small bit from the tumor, or by introducing a tube into the chest and then taking a small bit of the tumor. So many a times the tumor is deep seated. You may not be able to access the tumor. Sometimes you may be successful in getting a little amount of a tissue, but that may not be adequate to do all the necessary tests. Sometimes the quality of the DNA within the tumor may not be sufficient enough to do the test properly. So in such situations, what do you do? So then the liquid biopsy comes as the savior. So not only the liquid biopsy has become a savior, it has revolutionized the genomic testing in lung cancer, not only lung cancer, many other cancers. So what exactly is a liquid biopsy? So the opposite of vis-a-vis the solid biopsy. Solid biopsy means you are taking a bit of the tumor. From the tumor you are taking a piece and then testing, whereas liquid biopsy is nothing but you are doing or looking for those mutations in a sample of blood. It is just like any other blood test. What you require is just 10 ml of blood. So how this is possible? Because now the scientists are able to identify and isolate the tumor cells which are circulating in the blood, and these tumor cells are shed from the tumor. Sometimes it is not the tumors, the cells as such, it is the tumor DNA. The tumor DNA that is shed from the tumor. So nowadays we have the technology to identify these cells or the tumor DNA and do all the tests which you were previously doing on the tumor tissue. That is, looking for those somatic mutations or the genetic mutations that drive the cancer. So many advantages for the liquid biopsy as compared to a tumor biopsy or a solid biopsy. It's much comfortable for the patient. You can do any number of times. You get the result sometimes faster. So, or naturally the question will come, is it as accurate as the solid biopsy or a tumor biopsy? Yes, definitely. It is as good as a tumor biopsy. Even now, the tumor biopsy remains the gold standard, but in patients where it is difficult to obtain adequate amount of tumor, or in patients where the tumor is inaccessible, or in patients where you need to do it multiple times, liquid biopsy is a good alternative to tumor biopsy. And the other advantage of the liquid biopsy is that you can overcome what is called as the problem of tumor heterogeneity. So when you take a small piece of the tumor, let us say a tumor which is approximately 5 or 6 centimeters, you are taking the sample only from a portion of the tumor, from a particular area of the tumor, and it has been found that the tumor is heterogeneous. The mutations in one part of the tumor may be different from the mutations in the other part of the tumor. So this is what is called as the tumor heterogeneity. The problem of tumor heterogeneity can be overcome in liquid biopsy because the tumor cells are shed from all parts of the tumor. So what you get, the DNA or the cells in the blood is a representation from all the different parts of the tumor. So it can overcome the problem of the tumor heterogeneity. So in the current scenario, liquid biopsy is becoming more and more widely accepted. It's getting more and more standardized and validated, and it is used not only in detecting the genetic mutations or the somatic mutations, so that we can use the most ideal drug for a particular patient. It can be used to identify the causes of drug resistance, to monitor the progress of the treatment as well. So I hope that the discussion on the liquid biopsy versus solid biopsy was helpful to you. So awareness is always power, and never give up. Thank you.